Are we ready to go? Yeah. So, hello. Welcome back once again. I'm Ms. Divya Mistry, Assistant Professor from Department of Biotechnology. And I'm again welcoming our guest, Mr. Samir Joshi today, and our HOD ma'am, Dr. Rama Fadke ma'am, and all the staff members and all the students for today's session again. So we'll just quickly go through who Samir sir is. So Mr. Samir Joshi is the founder and chairman of Transgender Services Private Limited, TSPL. He's an engineer with post-graduation in business management, and he has more than 27 years of cross-continental corporate experience across India, over Asia, Europe, and North America. He was honored with the award of India's Most Trusted CEO in May 2017 in the education industry by the World Council and Research Corporation, WCRC, Singapore. And he's going to give us a guidance session on career opportunities in healthcare today. And we already know, we have seen it yesterday, the brand name of the services provided by Transgender Services Private Limited is iTransform. And the purpose of this enterprise is to bring transformation in education and healthcare sectors in India for well-being of the people of India. Yes, and their mission is to empower people and trigger self-sustenance for everyone in healthcare industry. Yes, and we already know that they provide services in education, healthcare, and technology sectors. So yesterday we had a very good talk on what are paramedic skills and what is actually the career in paramedical sciences. Yes, and we would really like all the students to get introduced to such kind of new platforms. And I now request you, Mr. Samir sir, to please deliver your lecture and give us more details about today's the session.
So thank you, Divya Madam, for aptly introducing us as iTransform Group. I appreciate. And to begin the session, I first would like to offer as a thank note to the entire management of Modern College and students. I think it should be a moment of proud and pride to you that your college is creating such kind of engagements where you guys will come to know about some really exciting opportunity that is knocking your doors as how you can shape up your career really to the medical or a healthcare industry. Can't start this session without offering my thank note to respected Egbote sir as well as Sundar Rao sir, whose extraordinary support has in fact given us more excitement as to collaborate with Modern College. Of course, Ranade Madam, who has been coordinating for this platform. So sincere efforts put up by all these senior management members from Modern College speaks a lot about the philosophy and objective of the college that it drives for students' excellence. So very happy to be associated with this kind of excellent education institute. And we also feel happy and proud that we are associated with Modern College on this. Right. So as I start the session, I would also request once again all my group members from iTransform, Dr. Seema Madam, Snehal Madam, Rashmi Madam, then Minas, Kratika. We have our student all the way from... One sec. There is a disturbance on the call. Yeah.
Yeah. Sir, your microphone is switched off. And I request all the students to please switch off your microphone. All the students, please switch off your microphone so it's easy to hear Samir sir.
Yeah. So thank you very much. Snehal ma'am is here. I think, good evening, ma'am. I think yesterday's your briefing was very elaborative and good as an insight to the students. So we also...
Thank you, sir.
Yeah, one special student, she is Seema Madam, our Director Academia. Thank you, Seema Ma'am, for joining us even today as sharing knowledge. Is Rashmi Madam on the call? Has she joined? Rashmi Madam. Minas, just if you back at the back end.
Sir, ma'am is joining.
Okay.
Network issue.
Yeah. So we also have Simran. Simran is on the call. Simran. I saw she.
Hello, sir. Yes, I'm there. Hello, sir. Good evening.
No, can't see you, Simran. Where are you? That's something which I want to introduce you to the friends from Pune. Yeah. So she's Simran.
Hello, sir.
Yeah, Simran is all the way from Gandhinagar at Gujarat. She's going to engage students on some special bar as a students engagement bar. So thank you to all of our iTransform family members who are I think somebody is unmuted again. So Murmai Lele. Okay. So students, as a bit of kind of rule for the session is, if you can mute your phones when the session is being delivered, it's in the benefit to all the students where you can hear us very clearly and with the least disturbance. I appreciate your cooperation. So here we start, and as I start, I think, of course, it's the 8th day of the new year. So I'm wishing you on behalf of iTransform a very happy 2022. I know the year has started with a lot of anxiety amongst all of us. In fact, today's newspaper, we have touched again 100,000 number today. And this number game is like making us more worrisome that how numbers are shooting and what should we be doing. Nevertheless, we are on the platform which is healthcare. So this platform will teach you also how to remain healthy, happy, and still be, making our way of life as a life where these viruses are going to come one after the other. So today is if I use Marathi word, third apatya of COVID-19, which we are all engaged with, right? COVID-19, then Delta, and now, oh my God, Omicron, right? So I think this is a way of life. We are all science students. So sure, this kind of engagement as a paramedic stream will make you more empowered to be healthy and happy as we progress our life. So as I begin the session, let me start sharing the screen. One sec. Let me just admit the students fast. Yeah. Okay. Now I hope the screen is visible to you all. Is screen visible? Hello? Is my screen
visible?
Yes, sir. Yes,
okay.
Yes, sir.
Great.
It's visible.
Great. I just wanted to have the information. Right. So let's go to the presentation bit. In any case, let me just see where is the one sec. One second, guys. I'm just getting message of more students. So I'm just allowing for student to come online. We'll start them. All children are joining, so I will just spend half a minute to get them online first. Yeah. One sec. I hope everyone is in now, right? So we'll once again go. So welcome to this interesting session about everything and anything that we are going to discuss about career opportunities in healthcare for today's youth. Of course, this is being carved out as a good session working with Modern College, of course, iTransform, our own group, and Jupiter Hospital, who are our healthcare partner in this entire journey. So this session is a culmination of working together. So Modern College has expressed their urge and willingness to share this note. iTransform, who is the skill and the education partner who is going to work on the entire academy, and Jupiter Hospital is, of course, where students are going to get their training hands-on. So as I begin, let me just share with you who are we. It's always good to know first that whom are you connected with, right? So iTransform is basically a group, an organization जो मुंबई स्थित है as a headquarter, and we especially are doing our work in 3 verticals, which is education, healthcare, and technology. And when it comes to healthcare, this is something, the presence what we have when we talk about our presence across Maharashtra. Right, so in Mumbai, where our headquarters is, it is this Kokilaben Dhirubhai Ambani Hospital. In Navi Mumbai, when I speak about it, is this hospital at Vashi. When it is Nagpur, we are talking about HCG, NCH or Kingsway Hospital at Nagpur. And when it's Pune, we are at Jupiter Hospital, where our center is operational as the Paramedic as operational center. I need to go to participant to mute somebody because still I get a lot of disturbance. Anushka Lele.
Samir sir, you are muted. We can't hear you.
Yeah, in a hurry, I think I mute myself. So I request all students to be on mute so that speaker can be unmuted, right? So this is a 4 districts presence of iTransform Paramedic Center, where we are operational, and we are handholding at present more than 250 students for their career progression in their life, right? So this is where we are. As we know, our new normal started way back in 2019. It's now our 3rd year of we living with our friend, which is our coronavirus, right? I'm saying it's like friend because we don't have a choice, and we have to make ourselves as a way of life living with this chap around us. So when we began this journey, with the inputs that we gave, with the training that we conducted, more than 100 trained students were skilled under these programs, and they were put into the meaningful livelihood. What we say is a job. In fact, it's such a happy note that today, as I speak, there are around 20 students who are deployed under 3 different sections of Mumbai city, which is Trauma Hospital, which is Jumbo COVID Center at Nesco, and which is Jumbo COVID Center at Bandakula Complex. Students just make this point very clear because they are just like you. They are doing their BSc. So somebody is in SY BSc, somebody has just appeared BSc, and somebody has just passed BSc. 3 exactly the sectors where I am connected with the students today. They are like you, and they are engaged by these Corona centers to help them for one of the job profiles, which is called as phlebotomist, or a person who takes the blood sample. All of you are aware of blood sampling. When you go for a pathology, for a blood testing, the first thing that you are interfacing with that professional healthcare expertise who takes your blood from your arm. That person is called as phlebotomist. So 20 of our students are engaged today. Today is the later which is gone, and Monday they are joining the duty. Right? So that something is a part of this healthcare success story that we are on. And with this kind of work, what we have done by our institute, I'm very happy and proud to share the award which we got as one of the finest education and skilling institute across the state by we getting coveted by Startup 2020 award by State Government of Maharashtra. So I'm really thankful to all my faculty members, of course, all students who are getting trained, all our hospital partners where they are being trained, and of course, Government of Maharashtra, who is creating such a nice work environment in the time which is critical time today, but that time is going to be there in a really longer period that we are envisaging. It will last for another 2 decades or 3 decades at least, right? So this is where is the backdrop. Now the slide which I'm going to share is a very, very important slide from your perspective. This is the slide which I'm sharing as a live example where our students are and what are they doing, right? So this is an actual real work photograph where our students are engaged in some hospital, nursing home, diagnostic center, etc., medical center, where they are either doing some X-ray work, CT work, operation theater work, pathology work, dialysis work, so on and so forth. Right? Why this slide is important? ये slide क्यों मैं बोल रहा हूँ आपके लिए important है? Because those who are really interested in making their way ahead as a medical life, you should imagine yourself, क्या मैं इनके जैसा हो सकता हूँ, हो सकती हूँ? Right? And that's the reason these students will inspire you as to, yes, it's possible that though I'm doing my BSc, there is a great job opportunity which is available when it comes to medical industry. Now, this is as far as the job domain is concerned. As I said in the beginning of the call, I also have one student as an ex-student of iTransform who is pursuing her post-graduation. So this picture which I'm showing is inspirational for you to connect directly into the job market. But I know as a journey of a BSc student, 90% plus BSc students have only one dream to pursue thereafter, the post-graduation, which is MSc. Now we have students, and I'm really saying students, but there is one such student on the call today, which is Simran Gupta from Mumbai, by the way, and now she's in Gandhinagar in Gujarat, right? And she also is an ex-BSc student, but she's doing post-graduation, not MSc, but post-graduation in the healthcare field. And that's the reason I would like now to invite upfront, before I start my dialogue, and invite Simran Gupta to share her success story. Simran, over to you. Simran?
Hello, sir. Can you see me?
Yeah, we can see you. I have stopped sharing. So yeah, there is Simran. All over to you, Simran. Go ahead.
Hello, everybody. Hello, sir. Good evening. First of all, congratulations on winning such a prestigious award. It's a half complete institution. So while I was in my BSc, sir came to our college for this little seminar. And I don't know, just that moment itself, I thought that I want to, take up my MHM, that is Masters in Hospital Administration. And for that, I would like to, pursue a diploma in anesthesia and OT technician. So I took up the whole diploma course and I did it along with my BSc course. So both were my full-time courses, but the timing was such that I could manage both at the same time. And it was very convenient for me, and meanwhile, I started searching for institutes as well. And then I came up, sir just, listed down a few of them. And one of them was IIPG, that is Indian Institute of Public Health, Gujarat. And
Simran, your phone is muted. Simran?
hello, sir. Can you hear me?
Yeah. Now it's...
I'm so sorry. So that is why then sir listed down a few of the institutes. So I just thought of applying at various of them, and I got into IIPG, that is Indian Institute of Public Health, which is in Gandhinagar, Gujarat. And yeah, so the whole 2 years that I pursued my diploma in anesthesia and OT technician, one thing that added, not one thing, a lot of things added. One of them, the most crucial one, was that I got to know how the whole hospital environment is. And to somebody who's pursuing MHA, I think that to know how the hospital works and how important it is to know the hospital environment, it's very crucial. So yeah, it helped me a lot, and I'm really thankful to sir for bringing us this opportunity. And we got to learn a lot. There was a lot of fun. We got to learn so many things. The whole course was so much fun. Various faculties coming from various other hospitals and teaching us, such senior people, and then you learning under them. And it's not just like related to that particular subject. They'll tell you like exactly what the whole surgery is about. And we just didn't learn what our subject expertise was. We learned a lot from them. We learned a lot. So thank you so much, sir.
Thank you, Simran. Thank you for joining us, and happy to see you doing good work there, even in your post-graduation at Indian Institute of Public Health. Thank you. So students, going back to our session now, I hope my slide is visible once again. Is it visible? Hello?
Yes, sir.
Yeah, okay.
It's visible.
Great. Okay, thank you. So this is where the aspirational slide, which I thought you should have a look at it. As we go ahead, yes, all our lead mentors, what we have from our institute. So Dr. Sima Madam, which I just introduced, Dr. Amit Desai, who is our HOD for Operation Theatre. We have Mr. Aditya Kumar, who is a HOD for dialysis. Aditya also had dialysis at Jupiter Hospital. We have Rashmi Madam, who is on the call even today. And she is going to engage you for radiology aspect as imaging technology mein kya future and what exactly briefly she is going to share the content. Likewise, Snehal Madam, who is our HOD for laboratory technology, and she is going to engage with you on what exactly is the medical lab technology as a program in terms of the curriculum and what are the job opportunities that you can have in front of you. As we go ahead, I'm going to share some 2-3 slides just to set the perspective before we get into the real program management and the details of the paramedics. What is paramedic? Because ये एक ऐसा सब्जेक्ट है जिसके बारे में ज्यादा कहीं कोर्सेज अवेलेबल भी नहीं है एंड लोगों को पता भी नहीं है एग्जैक्टली ये क्या होता है. एक दिमाग में सबके ऐसा रहता है कि 11th में साइंस में जाने के बाद जो मेडिकल में जाना है उसको नीट देना पड़ता है और उसके बाद वो MBBS, BDS, फिजियोथेरेपी, सो ऑन एंड सो फोर्थ, BHMS, BAMS वगैरह कोर्सेज को चले जाते हैं आफ्टर द नीट एग्जाम. तो ये पैरामेडिक क्या होता है? बिकॉज अगर नीट एग्जाम की बात करें तो इंडिया में 15 लाख स्टूडेंट्स नीट देते हैं, बट नीटली पास होके खाली 1 लाख लोगों को एडमिशन ओपन होती है फॉर रियली गोइंग फॉर द medical examination. एक मिनट, let me just add the students in between. And yeah, it's actually a little disturbing when somebody comes late. So ये paramedic क्या होता है? तो what I thought we'll first understand is the paramedic as, if I put it very simple, it's parallel to medical. And really, if I just pick up some 4-5 letters from both these world of parallel and medical, paramedic is parallel to medical. So actually, this is a profession where the professional executive is not a doctor, nor she or he is a nurse, right? So they are not doctors, neither nurses. So who are they? So they are actually called as technologists with the job role as a dual job. These people who are termed as paramedic or technologists have 2 job roles to do. One is they have to manage the technological aspect of the department that they are working in. And second is they will have to also take care of the patients as a patient interface. And this is called as a dual job role. So agar pictorial mein present karu, because as it is, I have shown you the students who are working in the individual department. But if I show you the pictorial representation, this is a right depiction of a job of a technologist as a paramedic technologist. So somebody is working in X-ray, CT, somebody is working in medical lab technology, somebody is working in OT, which is operation theatre, or somebody is working in dialysis. This is where your job profile or will give you the feel, the way once you are trained and skilled, you will be working like. So कोई भी पिक्चर में आप देखिए, कोई भी ये फोटो में देखिए, the person who is actually having that medical attire, you know, that lab coat, either white or a blue scrub coat जिसे बोलते हैं, या green coat जो OT में भी डाला जाता है, that person is a technologist. So on one side, he or she is handling some equipment, right? That every picture is a constant in she or he is handling some equipment, which is a medical technology. And on the other side, they are being interfaced with the patient. कोई भी पिक्चर आप देख लीजिए, एक्सरे हो, सीटी हो, मेडिकल लैब टेक्नोलॉजी हो, जो ये जो पिक्चर है उसमें वो फ्लोवेटोमी कर रही है. That person, medical lab technologist, is doing the phlebotomy. He's taking the blood sample of the patient. While on the other side, he or she is entering the lab and actually doing the testing and analysis of this sample which is taken. And that's their dual job. Technology on one side, while patient interface on other side. Likewise in OT, likewise in dialysis. Right? So this profession of paramedic is called as technologist with the dual job role. You have to manage a technology of that medical equipment like an engineer. And at the same time, like a doctor, you have to work for the patient interface. Now, अगर ये हम लोग टेक्नोलॉजिस्ट की बात करते हैं तो क्या डिमांड है इसकी, राइट? एंड न्यू नॉर्मल जिसे कहा जा रहा